Hello everyone. In today's video, we will be giving you an explanation about uterine natural killer cells in the endometrium. This is abbreviated as small u NK cells. Remember, NK cells stands for natural killer cells. These are the cells which are actually present in the blood. They are peripheral cells. Name is simple, natural killer. That means they are born to go and kill, right? Very, very important part in the immune system is played by these cells. There is a certain concentration in which these cells are present in the peripheral blood, and that is called as peripheral NK cell measurement. What happens is, out of the blood, sometimes some of these cells go in the uterus and establish some activity in the uterus. This activity of the uNK, uterine natural killer cells, is extremely important for a person to have a pregnancy which is successful. And uNK cells form a very important part of the reproductive immunology. In this video, I will brief you about what is this uterine natural killer cells, how it works in the uterus, what it does to the embryo, what happens when it goes rogue, when it goes, out of line, how do we test it, and how do we treat it. Whenever we are trying to look at this is the embryo. All right, this is the blastocyst embryo which has come inside the cavity. Uterine natural killer cells are present here at the periphery. Some of them are going to also enter inside the endometrium. And remember, uterine natural killer cells are different as compared to peripheral natural killer cells. They are both different. It is the hormone, which is estrogen and progesterone, both of them. Where are these guys secreted from? They are secreted from the ovary, from the follicles. The follicle grows big and secretes estrogen, and then it gets converted into a corpus luteum which secretes progesterone. Both these guys, estrogen and progesterone, go and act onto peripheral natural killer cells and convert them into uterine natural killer cells. Now, this uterine natural killer cell is very important to make sure that this embryo which has come inside, this embryo gets a smooth environment to go and achieve an implantation. There is a lot of interaction between these two people, between the uterine natural killer cell and the embryo. The embryo will typically present HLA-C and G antigens, and they will go and activate the KIR receptors which are present on the uterine natural killer cells. Basic. If I go into details, you will not understand. So remember, the uterus requires a particularly set concentration of uterine natural killer cells. Now, this is going to be typically 10 to 20%. This much is enough. If you have more uterine natural killer cells, which happens especially when you're having uterine inflammation, pelvic infection, endometriosis, adenomyosis, recurrent failures, endometritis, in all these situations, uterine natural killer cells will go up. That is bad for implantation. Let's assume you have severe immune suppression, very poor immunity. In that situation, uterine natural killer cells will go down. In both the situations, implantation will fail to occur, abortion rate will go up. Now, this is the problem. As a result of this set concentration of uterine natural killer cells is very important. God, nature, they maintain it beautifully for a normal uterus. Correct? The problem occurs when there is a normal uterus and uNK is not correct. So how do we diagnose this? Simple. See this. Where is this guy present? This guy is also present in the endometrium. So in order to diagnose this, you need to go in the endometrium and take a sample out of this endometrium. Typically, uterine natural killer cell will get activated when there is close to implantation. So when is it? Especially when corpus luteum is formed in the second half of the cycle, you need to take a biopsy and study how much percentage of uterine natural killer cells is there. Very simple studies are there, with something called as immunohistochemistry. We try to mark it at something called as CD56. As a patient, just remember this. There is a concentration. How much uterine natural killer cells? Once we get this concentration, we are able to divide the patients into three categories. Very simple three categories. either the patient is normal, matlab bhaiya this guy requires no treatment, or there is immune suppression. That means uterine killer cell activity has gone down. So we need to add uterine killer cells. So we need to give stimulation to the immunity, immune modulators. Or third, uterine natural killer cell has gone up and we need to give the patient immune suppression in order to make sure that implantation occurs. Guys, remember, if you study all the topics for reproductive immunology which I have taught and presented, this is going to be an important topic because in real life situation, we don't just look at uterine natural killer cells alone. We look at everybody. So what do? In real life situation? We study uterine natural killer plus MUM1 infiltration plus BCL6 plus interleukin 8. We study everybody. We combine everything. We combine the knowledge. We use the analysis like AI in our head and we come to a conclusion that, अच्छा, this patient is fine. छोड़ दो इसको. This patient is not fine. This patient is hyperactive and you will be treated accordingly. This testing is very important when indicated. When is it indicated? If you have had more than 3 abortions or if you have had more than 2 IVF cycles paid. Do not go and test it when you have had 1 abortion. कोई point नहीं है. Do not go and wait till you have 5 abortions. You may avoid certain abortions because of this testing. But go to a specialist. When you want to do this testing, we do it on an automated plasma machine, automated IHC, automated slide preparation. Thoda sa expensive, little expensive, but the outcomes are absolutely big time. Any more questions on this? Put it in the comments. Me or my team will get back to you.